you make a very good point. And this is just going to throw a statistic out here. 70%, this is an average course, 70% of your total health care spent in your entire life will be spent in the last 3 months of your life. And as a society, if we can't get a control on that, we're not going to be able to provide that health care up front. We're not going to be able to provide for our children's education. We're not going to be able to provide for all the other things in life that we need to do as a society, because we are taking so much money to health care at the end of life. And the reason is, because as mentioned before, our whole health care system is based upon procedures. Doing these things, these real expensive gadgets and whistles and bells.
One other point, too, on an inconvenient truth. Choice is not between sending somebody out like the Vikings did. That's not what we're talking about. That's not funny either. What you're talking about basically is hospice care as opposed to putting somebody in a respirator for $10,000 a day. This is an issue that shouldn't be delegated because the consequences are huge. And I had a question that somebody asked, how would you squeeze, what are the biggest items of expense? I indicated I thought procedures and so forth. I was more diplomatic in not mentioning the end of life. You must come from a secure district. But it is an inconvenient truth, and I think as a community, as adults, we got to face that. It isn't going to go away.
You're right. I was running for office, my first campaign manager. I got a discussion. I brought that statistic up. I said we have to come together as a society, and we only have so many resources out there. We only have so many resources available for healthcare, or education, or protecting our environment, or public safety. And we have to decide how we're going to allocate those resources and get the most we can get out of them. And she told me, don't you ever say that again in a public forum. So I haven't learned yet. That's probably, but we have, as a society, we have to realize that eventually we're going to have to make some tough decisions individually, working with your family, your clerical, and also with your healthcare provider. What's the best course?